that way when they want to reprimand them.
Being aware of your gestures and how you are communicating nonverbally is important to cultural competence. People may respond to offensive gestures with expressions of anxiety or discomfort. Ask if you have done anything to offend that person, and be willing to apologize for your actions. This will help to keep communication open and to reestablish trust. Books are available that teach appropriate gestures for each culture. 2 of these books are listed at the end of the video. Other factors that influence the quality of healthcare are gender roles, language, and literacy. In some cultures, women are extremely uncomfortable being examined by a male. Successful treatment of women from Muslim or Asian cultures may depend on matching them with a female physician. In some cultures, men have a difficult time trusting a female healthcare provider. Language differences can be a barrier. If English is not the primary language, a translator may be necessary to assure quality health care. Family members may not understand how to convey medical terms. Always use a professional translator whenever possible. Do not assume that clients can read. Never rely on only written instructions or assume that written material will be read if you leave it with someone. How much space people need around them in order to feel comfortable is culturally determined and learned very early in life. In most social situations, Americans maintain a distance of about 30 inches. Latinos, Africans, and people from some Middle Eastern cultures can be much closer to each other, while people from Great Britain require more distance. Gender, social rank, and authority also affect what distance people from different cultures consider appropriate. Developing awareness about the importance of personal space is part of providing culturally competent care. The definition of appropriate touch varies from culture to culture. Italian and Central and South American people tend to be highly tactile. Each culture has its own standards that define when touch is considered polite or appropriate. Every culture also has its own taboos regarding touch.
If you touch somebody else's head like this, or we can touch friend like this, but for Vietnamese, if you don't know them well and you touch, or even though in some cases they know well, we know them, you know them well, but you touch them, and they may get angry because for Vietnamese, and I would say that other Asian people, they think that their head is just to worship. They use their head as to worship their ancestor, or it's a very sacred thing that that's untouchable.
Even something as simple as giving a bath, particularly if you are in home care. There are quite a few cultures that have strong feelings about you can't touch the feet and then go touch the chest or touch the head. So if you're going to be giving a bath, you need to go from head to foot, or some that don't want the head of, say, a baby touched. And I'm thinking in terms of what I'm used to of, you can't feel, say, femoral pulses and pedal pulses and then go and listen to the chest. This is a taboo. So again, trying to find out if there's, asking the patient, how would you like me to proceed with giving your bath? What parts would you like me to do? And that's where you would pick up the clues that maybe it's important, maybe it's not important.
People will often give clues about their preference for personal space and touch. When you sense someone withdraw from touch, you can take that as a cue to behave in a more formal way, mirroring that person's behavior. If you feel as if someone's invading your personal space, remember that personal space is culturally learned. You can choose to move away, or you can honor the interaction with that person by suspending your own cultural preference. Cultures measure and respond to time in different ways. In America, we value efficient time management. In healthcare, we make appointments and expect people to be on time. For some cultures, clock time is not as important. Finishing a conversation at a relaxed pace holds a higher value than being on time.
If you talk about the Mexican-American elder, there's some very important values. One of them is how you enter into the healthcare exchange. And you enter into it informally, talking to them about social irrelevant issues to the clinical setting, because that's what they expect from you. And then after you've dealt with that, then we can move on. And I'll give you an example because I'm not sure that I'm making myself clear. In other words, if I were to come in your home, before I would immediately want to deal with your wound, or before immediately dealing with your diabetes, or before immediately dealing with your injection, I need to ask you how you're doing. I need to ask you how your kids are doing. I need to ask you about Maria that you told me was getting married last week while I wasn't here, and how was the wedding? And I need to ask you about your grandson Robert, who was sick the last time I was here, and you told me about him and how he was feeling. I need to ask you about all of those things because they're important to you. That's kind of like the important value.
It's important to take into account the different values people have about time. Expectations about meeting appointment times may need to be flexible and negotiated. Scheduling an appointment after a routine activity, such as a meal, may work better.
Because people's beliefs and practices around being sick and staying healthy may be different from one's own, we need to understand what theirs are and work with them. If, for example, one cannot give a patient that is just a newly arrived immigrant from another country, and I won't even say any country in particular, but say they don't even speak our language, and if they were just diagnosed as a diabetic, we just can't hand them the American Diabetic Association diet saying these are the foods you should eat, because they're not going to have those foods.
Each culture has its own food preferences and food taboos. Successful care of people from different cultures must include awareness of and respect for their traditional diets and food restrictions.
I remember one example where we were pushing a diet to build somebody up for surgery, and this was a person that had just recently immigrated. The food was so detrimental to their intestines, they just weren't used to it, that they had diarrhea all the time. So we were working against ourselves, so we made it worse. If we could have had the family bring in foods they were used to, that would have met everybody's goals better.
In many cultures, the family plays a large role in how people make decisions.
In the Vietnamese family, there are people that make decision maker. It could be the breadwinner. The breadwinner could be your son, or the oldest son. The oldest son would be the decision maker, even though he's not a breadwinner of the family. And parents sometimes have to listen to him in order to make decisions for the whole family. The role of the oldest son in the family is very important.
So then after her would come my oldest sister. She would be the decision maker then in the family. Just like my grandmother was the decision maker in the whole family, you know. If that's what Grandma said, then that's what happened.
In some cultures, it's the husband that has the right to say if I have surgery or not. In others, it's the oldest son that is the spokesperson on health decisions. But you can't know all the cultures in the world, so you have to ask them who would they prefer that we talk to about the details of their care. Many times in our culture, we want to know all the answers, but that's not true in many other cultures. For example, in many Asian cultures, you never tell a patient that they are dying, and you don't give them all the details. You never give them the results of all the tests. You give that to the family spokesperson. And they decide how much information they're going to give the patient because they see that as their protective role of their mother or their wife. And we're interfering with that if we just blurt this all out.
Sexual orientation can affect health care in a variety of ways. Gays and lesbians may find it more difficult to locate open-minded healthcare providers because of stigmas about homosexuality or fears about AIDS. Medical decision-making is often more difficult for gays and lesbians than for others. If one partner of a gay or lesbian couple is in intensive medical care, the wishes of the significant other may be ignored because there is no legal marriage or because of family conflict or disapproval. When possible, the patient's choice for a decision-maker should be honored.
If you're providing care to an elder from a different racial or ethnic group, there's some things that you need to be aware of. The first one is, as the person providing care, you need to know a little bit about yourself, your culture, what your beliefs are, and what your values are, because they're going to come into play when you encounter someone with different beliefs and values. So you should know a little bit about yourself and who you are.
To understand more about your own cultural background, ask yourself questions such as these. What cultural group do I belong to? Who do I go to when I am sick? Are there foods I don't eat because I consider them dirty or unhealthy? What are my religious or spiritual beliefs about health and illness? By becoming more aware of your own beliefs, values, and expectations, you can consider how these affect the care you provide to people of other cultures. Other questions to ask yourself are, do foreign accents irritate me? Do I believe that everyone should be able to speak English? Am I fearful of certain cultures or people? Do I assume to know what is best for the person I'm caring for? That I understand his or her wants and needs? If care providers make assumptions or expect certain behaviors from people of specific cultures, these stereotyped attitudes can create barriers to care. No one is ever exactly like the description of his or her culture.
In Indian culture, it's not always the same. She's a different tribe than I am. Mm-hmm. I'm a different tribe. And even the area from which you come makes a difference. I'm from the southeast. She's from the west.
You're from the South Plains, and I'm from the Northern Plains.
They had a different way of obtaining food, shelter. We had a different way. And also, when the Christian people came, they encountered us down there. We are Southern Baptists mostly. Where she lives, probably Catholic or Jesuit priests came out here. So all those little things make a lot of difference in the way we react in our adult life or to a situation.
There is a lot of variation within a culture, and there's even more variation. There's more differences between people within a culture than there are from one culture to another culture. There's just huge ranges. So all these rules, etc., are really just guidelines and signposts saying there may be something different here, but you always have to check it out with the patient, validate with the patient that this is what he or she would like you to do.
Cultural assessment tools help us to better understand cultural and ethnic factors that affect health care. Important areas covered in a cultural assessment include language, literacy level, communication style, food preferences and taboos, religious beliefs, beliefs about the cause of disease, attitudes toward Western medicine, and use of folk or traditional forms of medicine. Family members may not wish to disclose certain information to the healthcare provider for fear of disapproval. When doing a cultural assessment, Ask questions that are open-ended and general in nature. These types of questions create an atmosphere that is non-judgmental and encourages the person to be more candid. For example, if you want to know who is providing medical care to that person, rather than ask, "Who is your doctor?" ask, "Who do you go to when you are ill?" Open-ended questions allow a person to feel free to talk about his or her medical doctor, spiritual healer, Chinese herbalist, or acupuncturist. Rather than asking someone, "What medications are you taking?" ask, "What do you use when you are sick?" This will allow that person to tell you about any medicine or therapy that he or she is using. Some herbal remedies can interfere with or potentiate prescribed medications. It's important to establish trust through open-ended questions to assure safer health care. Other important questions that will help you understand that person's beliefs about illness and health are, what do you think caused your illness? What have you been doing or taking for this illness? Is there something about your culture or religion that I need to know to give you better care?
You also need to understand historical factors that may be a unique trauma or stressor to the particular racial or cultural group that you're working with. If we look at the Japanese American elderly, certainly one of the unique experiences for that population would be the Japanese internment in the United States during World War II. If we look at the African American elder, a unique historical event that helped shape who they are would be Jim Crow and the whole institution of segregation.
To become familiar with a person's history, consider these factors. Where was the person born? Under what circumstances did he or she arrive in this country? Was there an experience of oppression? Does he or she have reason to be suspicious of Western medicine or authorities in general?
Another important historical factor that would be important to know about African American elders is the Tuskegee study. The Tuskegee study was a study of untreated syphilis that lasted for approximately 40 years.